nice to talk to someone who wasn't like, well, I
did it like this.
Yeah, exactly.
I'm Danielle Brooks, and this is A Little Bit Pregnant. Each episode, I'm talking to the experts about pregnancy, parenthood, and everything in between. This episode, what in the doula? All right, y'all, I'm gearing up. I got 6 weeks to go before this baby comes out of me, and I keep hearing about doulas, and I know nothing about them. Maybe a little bit. I hope you'll come with me and learn as we talk to the experts. In the meantime, hydrate.
I'm very, very scared of childbirth. That's why I'm going to hire a doula. You know what a doula is? That's a white hippie witch that blows quinoa into your to Kaiser Soze all the pain away.
I'm here with Domino Kirk. I'm super excited to have her. And she's one of the co-founders of Carriage House Birth. You know what I was going for. Anyway, can you please break down, talk to me about doulas, just educate us, because we need help.
Doulas are emotional, informational, spiritual, physical support for the laboring person and the family.
I just want to talk about the difference between a midwife and a doula, because when I first came in, I was like, I thought they was the same thing. And they're totally really not, right?
Midwives are medical professionals. They're medically trained. They can do everything except surgery.
And the difference with the doula is, between the midwife, is that the doulas can't necessarily deliver.
No, we're not catching your babies.
Okay, but have you caught a few?
I have.
So how early in the process do you think one should even bring in a doula?
I mean, as early as they can, but we, as doulas, we get called like at 37 weeks. Like, oh my God, I heard I need a doula. I need you, like, tell me everything. Can I meet you once?
That late?
And some people pee on a stick and we're hired.
And how is it for doulas working with dads?
We like to say partners, because they're not
Partners,
always male.
that's true.
The person in labor just starts to vomit, or there's a lot of blood, or a big thing that could be scary. The partner looks at the doula and is like, well, if they're not scared, I guess everything's fine. So we're like we gauge the room. Partners end up loving doulas because we relax them and give them less to do so they can hone in on you.
Which is nice. Okay, give me an example of what a doula would actually do while I'm in labor.
One way that doulas tend to tell people how to breathe is just circular breathing.
Okay.
So you might completely like ditch this when you go into labor and be like, I don't know what she was talking about. But one way...
I'm breathing. I'm breathing. I'm breathing.
But one way is really to just take it in through your nose really long and slow and blow it out of your mouth. And as you blow it away, you're also blowing away the tension that is in your shoulders and your neck. And so you can really feel how that circular breathing is moving through your body versus like, the in and out of your mouth or holding your breath until it's done. Circular breathing is actually just moving everything through.
So what are some tips for people who can't afford a doula, who might not want a doula?
One thing about people who can't afford one, there really is a doula for everyone. So there are volunteer services. It's much more the category of people who just feel like they don't need that kind of thing. But let me tell you, those people always end up calling someone.
One tip, what would it be?
Picking your team is so huge. It doesn't matter what hospital you're in, or what place you're in, as long as the people there are for you. Make sure they're the kind of people that you could take a poop in front of.
We talked to Domino, but I also heard about postpartum doulas. Did you know that was a thing? Okay, y'all. So I am here with my friend Tadesia, and she is just golden. She's a new mother of, how old is your son?
7 months old today.
7 months old today. Yeah. And you said this thing moves fast.
So fast. So fast.
Well, I need your help. I need your knowledge.
I'm going to give it all.
Give it to us.
To you.
Give it to us.
Yes, because I'm constantly receiving it. Anytime I see a mom, I'm just like, what do you do? What's your secret?
Yes.
You know?
So, I want to talk to you about the doula thing.
Okay.
Did you know about doulas before being pregnant?
I did know about doulas
Okay.
before being pregnant. When me and my partner Curtis together. He was just like, we don't need a doula. Like, I've got you.
So you didn't get pre-doula,
No.
if that's the thing,
Right.
which is guess was really called just the doula.
Just a doula.
And you did something called post-doula.
Yeah.
Well, did she live with you?
No, she'll come over for like a couple of hours,
Okay.
3 hours at a time. She'll ask me how everything is going, give me any advice that I need, any questions that I have. She's incredibly knowledgeable. She's a baby wearing expert, so she taught me how to wrap the baby and wear him, which gave me an immense amount of freedom.
Did she talk to you about breastfeeding?
Everything. She's a lactation consultant, so she taught me about breastfeeding. But more than that, she would always bring me a cooked lunch. She would wash. Yeah, she cooks for you. Wash my dishes. Take out my trash.
She did your dishes.
Make sure my trash. Make sure we were both down for a nap before she left.
You may have to drop me her number.
No, she's amazing. Yeah.
So did you have any misconceptions about doulas before using one?
Yeah, I just didn't realize how essential they could be.
Hot 96.3, Ash Mack here, and this is a very important conversation. We are having a special weekend to get inspired, to get uplifted, but more importantly, to highlight women because, March was Women's History Month. And as we want to continue these conversations, we want to inspire her, get the information to talk to the women that look like me and you, the ones that are fresh college grads, the ones that have 1 or 2 degrees, 1 or 2 to 3 jobs, have 1 to 2, 3 children, and the ones that don't have it all figured out yet. Because I fit in that category too. So if that is you, then I want you to join us for this conversation today as we talk about childbirth. What is a doula? What is important about having a doula, and sponsored by Indiana Minority Health Coalition Doula Program. So I have more than a few special guests today, and let's just bring them on to the stage. Hey, ladies.
Hello. Good morning.
Good morning. So I just want to go around and if we can just introduce everyone, starting with doula Bev Horton.
Hi, good morning. My name is Bev Horton, and I am the lead doula with the Indiana Minority Health Coalition.
And I am Erica Pedroza. I'm in public policy at the Indiana Minority Health Coalition.
I'm Lucinda Reese, a birth and postpartum bilingual doula for community health doula services.
Perfect. Now, I was just saying a lot of my friends are looking to and experiencing the more holistic approach when it comes to childbirth. So what is the difference between a doula and a midwife? And feel free for anybody, everyone to jump in. Yeah.
Okay, midwives are usually more medical and social providers, while doulas, and they don't take the place of a doula. We actually work together as a team. So the midwives are more the healthcare profession as far as the team goes. And then for us, the doulas, we provide the support, advocacy, and the hands-on support during the birth and laboring. And then, of course, postpartum services as well. We also provide education for the mom, during birth, after, and provide comfort measures, answer questions, just a continuous support the medical providers might not be able to provide because they're in and out of the birthing room.
Gotcha. Okay, so I think this goes right into our first question, second one. Bev, can you describe for us the role of a community doula in a client's life and the difference between a community doula, community-based doula, and an independent one? How could I find you, and how do I figure out what's best for me in my situation?
Yes, I'm glad you asked because the role of a doula, a community doula, is to provide that emotional, that physical support, and help them to be well informed while they are pregnant, and during labor, as well as we follow our clients up to their baby is a year old. So no matter where she is, or no matter where whoever is in their pregnancy, whether that's 6 weeks, 8 weeks, 24 weeks, however, wherever she is in her pregnancy journey, we are there to provide that continuous support all the way up until she gives birth, as well as until the baby is a year old. We do that, and our services are totally free. And as far as an independent doula, to my understanding, they really meet the client in their third trimester. So in that last trimester, and they pay for that. So an independent doula charges for her services, and we don't. And so if they were trained by the same entity that we were trained by, they pretty much provide the same support, but we have a continual support and follow with our clients. So that is pretty much the difference.
So for anyone that does not have kids, which is me, I'm the one or one of the last ones of my friends that don't have children at this point in my life. But when is the right time, if there ever is a right time, to begin the process of researching or finding a doula?
I'm going to say right away.
You can actually have,
Oh, go ahead.
yes, as Bev was saying, you can actually hire a birth doula or a postpartum doula, but a birth doula at any time during your pregnancy. We, for community doula services, accept them at any point in their pregnancy. So if they don't start from the beginning is the best time to hire, so we can follow you through. We can also attend different appointments with you, with your OBGYN, if you have a specialist. If you have a high-risk pregnancy, we can also attend those appointments with you. But you can actually hire a doula at any time during your pregnancy. And to kind of go along with what Bev said, if the moms qualify for any kind of Medicaid or government services, it's absolutely free services for them.
Oh, okay. So it sounds like the process of finding a doula, it's like finding your bestie. You know what I mean?
Yeah, basically.
Yeah, because everybody tells somebody about the services. So if you're a friend of a friend, they're always telling, the next person about what's going on. And doulas are becoming the hot topic. So I'm excited about that.
Yeah.
Why do you think it's becoming more normalized now in 2021 than it ever has been before?
I think because people are more informed about the services that we have. Before, doulas were only seemed to be suggested to support women of a different stature, I should say. And because we're in the community, excuse me, because we're in the community, we're walking with the community. And again, the community talks to the community.
Right.
It's from one woman to the next. And when they have that experience with us, then they tell their friends. And so I think we're just becoming more aware of our doula services and that support that we offer them. And so, yeah, they're having pretty good outcomes because of doulas. So.
Okay, so there is a question that was asked in the video that's played earlier. It talks about what a doula does during labor specifically. So Bev and Lucinda, as a doula, what specifically do you do during pregnancy, during labor, and during postpartum?
Yes. So during pregnancy, we're meeting with them. We do home visits. We also educate them about the pregnancy. We talk about breastfeeding. We educate on what it is, or if they have questions, we're having them keep journals. We're also doing some physical things with them, such as helping them get on the birthing ball once they get into labor. We're also using the rebozo, which is like comfort measures. So breathing techniques, things like that, all comfort measures during that labor. And then postpartum, we're talking about milestones. We're helping them through if they need support as far as emotional wise. A lot of women go through postpartum depression. And so we are just asking those questions, those open-ended questions, to make sure mom is taking care of herself, as well as bringing in the dads as well. So it's an all well-rounded support group that we have. So, during the pregnancy, that education that we're doing with them, that nutrition, home visiting, and then also going to them to their prenatal visits. So it's a well-rounded support that we offer during those times.
Now, when it comes to
Okay, and
support,
just
you mentioned, no, I'm sorry, go ahead.
That's okay. I was just going to add to what Bev mentioned a little bit during the birthing rooms. A lot of the comfort measures, in case people don't know, comfort measures mean helping them get on the birthing ball, which is just looks like a big, large exercise ball, and we help them sit on there. And a lot of times that helps relieve a lot of the pain in the lower body for the mom, and helps also open up the pelvic floor and the pelvic floor muscles and things like that. Just relieve some of the tension and cramping, and helps the mom breathe easier to prepare for birth. So we try to help them have the most natural birth possible and allow the mom to just labor through the birth as much as possible, which that helps us eliminate using the use of Pitocin and things like that to induce labor. A lot of times our moms of color are in a way just kind of going through birth without allowing them to just have the most natural birth as possible. So a doula helps prevent that a lot, which I think it was mentioned also in times past. Since doulas are very expensive when they're paid for, now us as doula, community doulas, it's free of service for our moms, our minority moms. We're allowing them to have the best birth outcomes as well, and it lowers the death rates for the babies and the moms.
So can I also add, and I don't know, Bev, I'm sorry if I missed it, I'm not sure if you mentioned it, but during that postpartum period, or sometimes what we like to call that fourth trimester, doulas can also offer breastfeeding support, can help to teach, a good latch, offer information on diet and milk supply or nipple concerns, and really just give a bunch of breastfeeding tips and hacks. Because I know like you, Ashmack, I'm not a mom either, but I've had lots of friends and families who recently just became a mother for the first time. And they had like so many questions, like, is this normal? Or what kind of bra should I be wearing? Just a wide range of questions that you can really turn to your doula for that information and support.
So when we talk about support, since we're both the friend that doesn't have children yet, but, there to be a help when our friends need them, maybe that looks like support of a partner or support of a friend. How can we do a better job of serving during this time?
Well, I'll start, but I'm sure Bev and Lucinda, being mothers, can probably better answer that. But a way I have done that is just really being present, and not having to necessarily reach out and ask for assistance, but just going over, like, let's say during that postpartum period, and holding the baby so she can go take a shower, take care of some things, or helping her out with stuff around the house. Really just being there as, like we said, like a support. But also in my life, how else I like to help is through advocacy. So like I said, I'm in policy. So I am kind of an advocate for the doula. So I know the doula is an advocate for the mother, but I'm also working to help educate people about doulas and help get some more policies through, or push for policies that help support our doulas and the career, that field of doulas.
Yes, absolutely. I totally agree with Erica. I feel like the support from behind the scenes that supports the doulas helps to empower us so that we then can empower our moms. So I think that it's like a triple effect. And I love that because, like Erica said, instead of waiting on moms to reach out to us for that support and help, we are constantly reaching out to our moms throughout that journey. When I say continue, I mean we are on the phone with them. We are doing video chats. We are showing up at appointments with them so that we can be there for them to have a shoulder to lean on. We're informing them. We're asking questions. We're giving, having them do research, too, so that they then can empower the next woman. So it's about teaching each one sort of in this situation. So yes, I agree with that.
So when we come to each one, teach one, especially I want to say during the gaps of possibly like our grandmothers to our mothers to where we are now, how are we teaching the generations before us about doulas? Because I know my mom didn't have a doula. Neither did my grandmother. So, you know, how do we bridge the gap and also making it more, I guess more acceptable or having acceptance through education?
Trying to unmute there. Well, I would say I have heard of the stories of certain maybe grandmothers or whatnot kind of being leery of, hey, I didn't have a doula, I did it myself. But I think it's important that they understand, like you said, the education piece is always so important, but they understand that they're not taking the place of the medical trained experts, but they're really there as an advocate, as a support, and that can't hurt at all. There's no harm in that. So I think just informing them about what the benefits are of having a doula, what studies show, and I think, and I know we may get into this a little bit later, but you know, there's a rising maternal and infant mortality rate that they did not, I mean, they experienced some of that back then as far as, you know, those numbers were there, but I think they've been growing in recent times and we've become more aware of it. So kind of educate them on that side of things as well. Yeah, I think any support helps.
Right. And I think that goes right into the question, Erica. You know, there is a high maternal and infant mortality rate here in Indiana, not to mention just the increasing stats and facts that we know about Black and brown women when it comes to death rates during childbirth. You know, how do we battle such things and how do we make sure to try to keep that as low as possible when it comes to these rates?
Well, that's a great question. So yeah, I want to start by just for those who are maybe tuning in who may not know kind of what it's like right now in Indiana. Indiana has one of the nation's worst maternal mortality rates. We're third worst in the country behind Louisiana and Georgia. And also in the nation, Black women are 3 to 4 times more likely to die of pregnancy-related causes than non-Hispanic white women. And so for every woman who dies, we know there are dozens more who experience also severe health complications.
Yeah.
So to address that, I know like for Indiana, we created a law that created a maternal mortality review board. It's a little too early really to see its impact, to see if it's successful. And then in terms of infant mortality, it's a pretty bleak outlook for Indiana. Also, I think we're like 8th highest of infant mortality, unfortunately. The governor has set a goal for us to be the lowest infant mortality rate by 2024 in the Midwest. We've seen some improvements, but although we've made improvements in certain areas, like for some infants continue to die at a higher rate than others. So like the infant mortality rate for white infants is still twice as low as that as Black infants in Indiana. So we still see those inequities. So I think a way to combat that is, so that was a big thing is having a doula. Like, so that's very important. And I know you've heard doula Lucinda mention some of the benefits of having a doula, you know, decreasing cesarean rates, shorter birth lengths and so forth. But aside from that, we also need to be working on addressing the inequity issues. We need to have structural changes that are found in our health, the inequities in our healthcare system. Women of color need improved access to care. All birthing professionals need implicit bias training. So a lot of this can be addressed through policies and laws or whatnot. So that's stuff that we're working on.
I was going to ask you, and let me know if you can or cannot answer the question, but because of equity, because of maybe just how the educational systems are set in place and it's catered more to westernized or European people of descent, you know what I mean? Is this a part of why we have such increased and skyrocketing rates amongst women and children that look like us?
Yeah, I definitely think so. They don't, right now, you know, the medical professionals, medical doctors do not have to go through any sort of cultural competency, implicit bias training. So I know this discussion has come up and talks about police brutality, but I mean, we also need to be talking about it in terms of in healthcare settings. So we know that women of color often experience bias and mistreatment in maternity care, especially, with one major concern being that they're often like their pain is often ignored. Their autonomy is not respected. And that's evident in the fact that many maternal deaths are preventable. So, and I would like to add that I think the reason why we really push to see some implicit bias training is that these disparities that exist in maternal mortality cut across educational levels, economic levels. So even Black women who have the highest of educations, very high income, they could be celebrity status, and they're still dying at higher rates than white women with no high school education. So I think that's really alarming when we look at it that way as to how is race playing a factor. So that's why I think it's so necessary to have some implicit bias training. They may not be aware it's there. I know that there was some studies done or surveys given to medical students, and they believe that Black people can tolerate pain at a higher level than white people. So it's those sort of crazy beliefs.
So many things that I can
right.
say stems from. You know what I mean? Like that annoys and frustrates me, and I'm sure it frustrates all of us, because that stems from a time of slavery. That stems from what we see currently in the nation, of the fact of we carry the weight and do the work for how many other people, and people just expect us to have and carry the burden for everyone else, and still somehow be successful and push through. But it's okay to say, you know what, I'm tired. You know what I mean? You know what? I can't carry this all by myself. And that should be applied to the medical fields, because right now, unfortunately, we're seeing our brothers, our sisters, our cousins, people getting killed on social media, on television screens, and we're seeing it and have to relive it every day. Unfortunately, the same thing goes on when you're in and bearing children, right? Except that we're not seeing it as much on the television screens. You know what I mean? So it's like, how can we help better assist and tell these stories? Because you can say the same thing is happening. You're just not seeing one more than the other.
That's so true, Ashmak. And when we talk about these things and like the trauma it's causing in us, we do have to be aware that like educating people on these Black maternal mortality rates and the inequities, that we're not instilling more fear in young mothers or women of childbearing age who might say, oh my gosh, well, I don't want to go through that. Maybe I don't want to have children. And it could lead, that fear, that worry, that anxiety could lead to further complications. So really we want to educate people and empower them more so than instill fear. Just empower them with information, and our doulas are there to help act as that support for them.
Right. Now, if you're just joining us, of course, we're in the middle of our Inspire Her seminar. What is a doula? Why should I have a doula? And I feel like we've talked to the experts. We've gotten more than enough information, and this is being sponsored by Indiana Minority Health Coalition Doula Program. Now, what if someone's interested in being a part of the program? How can I sign up for this?
You can find us. We're on social media. Doula Bev, I'm out there. Doula Lucinda, all of the doulas. We actually have a male doula now that has joined the team to support our partner. Yes, so that's really impactful. So we are out there on social media. We're posting, we're inviting people. So everybody, just about everybody, I should say, has social media. So that's where you can find us there. Out there on social media.
And I know we mentioned it briefly.
And if you do not have social media.
Oh yeah, go ahead.
I'm sorry, if you do not have social media, you can call 1-888-4-DOULAS as well. Yes.
Okay, perfect. Because I'm off of social media for Lent currently, so I know how that is. Listen, you got to pull back a little bit, get grounded, go online and focused. But how do we focus on taking care of our partners? We mentioned earlier about, you have services for partners. You mentioned you have a male doula now on board. How is that process going? And maybe there's a partner out there for men and for women that are trying to be more supportive during these times. What service and how does that service, what does it look like?
So,
Yes, we are super, super excited about our male doula that's on staff now as well. So some people prefer working with a male doula just when they choose a medical professional to work with them, because there is a partner involved. And so a lot of times to get our partners involved, it's just about education and encouraging them to be comfortable with everything that goes on through the labor, through the birthing process, and then just preparing during pregnancy up to that point. So we can also train the partners, whether it's mom, sister, cousin, husband, boyfriend, whoever. And if they don't have a support system, that's where we come in also. But we can also train the partners to do the same kind of comfort measures during birth. They can also call us in the middle of the night if mom is not willing to, or mom is hesitant about reaching out to us. We're available to them, especially about 2 weeks prior to birth and 2 weeks after their due date. They can call us 24/7. So sometimes the partner is the one that will step in and do that when mom's a little hesitant, and just offering that support through everything. And just, again, education, advocacy, to provide the best pregnancy experiences possible.
Perfect. I mean, I think I found some new best friends today because y'all say we could call at any time when needed. Okay. You're going to help me. You're going to pull up to appointments with me. Okay.
absolutely.
Ladies,
Right.
every time yes, listen, if you hear from me, just know that I'm not with child as of yet, but I might know someone that is, and I need you guys to come on air to talk about this. Because you know what? There's always something new to learn, to help share and spread our light and to inform somebody that needs the information, but doesn't know where to turn to. So thank you so much for your time today. Again, if anyone has any questions, what is the phone number as well as website and how to get in contact with you all directly?
So the telephone number is 1-888-4DOULA. And the website is communitydoulaservices.org. So 1-888-4DOULAS. And then the website is communitydoulaservices.org. And then again, you can look up doula on the social media if you have it, and then all our names will come up.
Yeah, and so I also want to add, so as you know, Bev and Lucinda are representing the community CDS, Community Doula Services. If you want to find Indiana Minority Health Coalition, we're also on all the social media pages. And I want to kind of shout out to a Doula Day we recently had. It's an event that we hosted for the first time last year at the State House to serve as a day of advocacy and education around ensuring doulas are fully integrated part of Indiana's birthing continuum. So this event took place on Wednesday, April 7th. It was a great event, great energy, great speakers. Don't mean to toot our own horn, but great info.
No, go ahead, because you have to give yourself flowers too.
Right. So please check it out on our YouTube account. So if you weren't able to make it, you can watch it on YouTube, which is Indiana Minority Health Video and Podcast Network. And follow us on social media for more events like this in the future.
And I want to leave, before we head out, if each one of you could mention at least one thing you would love to see moving forward, 2021 and moving forward, when it comes to doulas and education about your profession. How would you like to see it either change, be embraced more, or just the educational piece of it? What is the future you would love to see with doulas being included in the same sentence?
Well, I'm going to keep it short and simple. When you see something, say something. When you see something, say something. That's more impactful than anything, because, and like we discussed, history repeats itself. People like to be quiet. We're told, keep it in the family. It's not the time for that. So when you see something, say something.
Agreed.
So wise. I'm gonna say
I would like to,
I'm not. Oh, sorry, Lucinda, but I'm not a
sorry.
doula. But what I would love to see for our doulas and for doulas statewide and doulas everywhere, and it probably is not going to happen in 2021, but we can start a push, is to see access to doulas available to everyone, regardless of socioeconomic status. So I know that we recently passed a bill, Medicaid coverage for doula services. But that still does leave out, and it's still getting worked out as far as making sure that gets fully funded and we can start having that happen. But also, once that happens, there's still a lot of women of color and other women who won't have access to doulas, who maybe don't qualify for Medicaid. So I'd love to see everyone have access. That's my dream, I guess, for the next few years. Hopefully, we can make it happen.
Yeah, we're manifesting and doing the work now. I mean, it starts with conversations like this, so maybe, people being able to receive this information in the way that they do, like on YouTube or from our website, now they know, and it's accessible and it is available to them. So, it starts here.
Right.
Yes, and I was just going to add basically the same thing. I would love to see every pregnant mom be offered a doula, even if they don't end up hiring a doula, if they can't afford it or not, to be regularly offered, and for people to know what a doula is, right along with the rest of their medical team when they go into a clinic, whether it's a private or public clinic, doctor's office, to know what a doula is and to be offered a doula at that time of early pregnancy.
And one more thing I'd just like to add too, to get rid of the old wives' tales, like of doulas aren't necessary, or they're trying to take the place of somebody else. I just feel like we're one body with the physicians and the nurses. We all have a role to play.
Yeah.
It's like I can't say to my paper, the pen has no need for you. No, we all have a role to play. So doulas have a role to play. So I just like to disagree with Erica and Lucinda and you. It starts here. So
yeah. Well, thank you, ladies, so much for your time today. Thank you for joining me today for our panel to continue to inspire her about childbirth. What is a doula? Why a doula? Being brought to you by Indiana Minority Health Coalition Doula Program. It's Hot 96.3.